Welcome back, friends, to TV5 News at 9. It's time now for Medical Moments with Covenant Healthcare. Joining us this morning is Nurse Ann Ostrander. Thank you so much for being here. Ann, how are you this morning?
I'm doing great, Colette. Thank you.
Of course. We're so delighted that you're here, Ann. So this month, it's all about the heart, and today we're talking about structural heart disease. Now, first, Ann, can you explain to viewers what that is?
Sure. So structural heart disease is actually found when one of your healthcare providers is listening to the sounds that your heart's making. When they use that stethoscope, they listen to the sounds, and if they hear anything abnormal, that is when they would either consult a specialist or order an echocardiogram for someone to have done. And the echocardiogram will show the chambers of the heart and the heart valves within it. And if there is any reason why they're hearing that abnormal sound, it could be from one of the valves not working properly. So that gives the specialist that is looking at the echocardiogram some information to what might be going on.
I love it. You made it so easy to understand, Ann. Thank you so much for that. So tell us about this TAVR procedure. What does it mean and what does it help?
So TAVR is what we call it, and it stands for transcatheter aortic valve replacement. What that is, it's a minimally invasive way to fix the aortic valve of the heart. It's one of the heart valves. The gold standard has always been surgical. So you would have a surgical incision to fix your aortic valve, and that has been around for years. But the TAVR procedure is a minimally invasive way to do this. And one reason why you might want to do something minimally invasive is if a patient has other comorbidities or other issues besides just that bad aortic valve. They could have diabetes or bad lungs, things like that might put them at higher risk for having surgery. Therefore, they do a minimally invasive procedure called the TAVR. How that's done is not through a surgical incision, but instead we go through the groin area, and that is how we access the heart valve, and we are able to replace it through a large artery in your groin that we go through.
Okay, so now we know about the TAVR procedure. Now there is another procedure being performed at Covenant to help reduce the risk of stroke. Can you tell us more about that, Ann?
Oh, sure. That is the Watchman procedure. This is for patients who have atrial fibrillation. Patients who are on atrial fibrillation, they have to be on a medication called a blood thinner or an anticoagulant. These can cause easily bruising, bleeding from the skin, or even possibly internal bleeding if you can't tolerate it. Also, patients who may be frequent fallers or at risk for falling and have to be on an anticoagulant, that could also cause a problem for them. So the Watchman procedure is an alternative to being on the blood thinning medication. What it is we also go through the groin area for this procedure. We go through a vein, and we are able to place it. It's kind of like an umbrella. It goes in small, and then when we get it in a part of the heart called the left atrial appendage, we open it up and place it just right, and then our body does the rest of the work. It actually forms a tissue layer over that device. So what I tell my patients is the Watchman procedure, when you come in that day for the implant, it's the beginning to the end of being on blood thinners. Because when you are discharged home from that procedure, you aren't completely done with the anticoagulant or blood thinning medicines. You have to take them for about 6 weeks afterwards until our body does its work and forms that tissue layer over the device.
Okay, well, thank you for explaining those procedures and breaking those down for us. Very easy to understand. So, Ann, what makes the Covenant Structural Heart Program so important to our community?
Well, we offer these procedures locally. So we have a team approach here at Covenant. So it's not just one physician, it's a team of doctors that for the TAVR procedure, we have a cardiothoracic surgeon and 2 interventional cardiologists. And they actually discuss each case individually and decide what would be the best course of action to treat a patient's bad aortic valve. And the same goes with the Watchman procedure. We have a team of doctors and interventional cardiologists and an EP or electrophysiologist, along with another cardiologist that specializes in reading the echocardiograms on those implant procedures. And it just brings this technology that's been around and it's been done at bigger institutions closer to home, so patients and families can be by each other and not have to travel quite as long of a distance.
Okay, well, Ann, if I was there talking with you, you were my nurse, I would have to say that you would just calm my fears and relax me. And the love that you have for what you do really comes across. So tell me, what is it that you love the most about working with heart patients?
I love being able to teach the patients and their family members. So when the testing starts, for example, the TAVR procedure, I meet with patients before there's even a possibility of them having it. And I just do some education about what it is, just to help them make their decision a little bit easier. The day that patients come in for these implants, I am with them. I kind of go over the plan of care that they're going to have for the day so they know what to expect, where they're going, what's going on. And then before they go home, I also am with them and I go over discharge instructions and what some restrictions they may have. Both of these procedures are done minimally invasive, but there still are restrictions when you go home, such as no heavy lifting of more than 10 pounds for a week, no driving for the first couple days, and trying to minimize stair usage for the first couple days.
Well, you know what? We appreciate you, and we thank you so much for being here in our community. Thank you, a big thank you to you and all your colleagues there at Covenant for all that you do for the community. Thank you for calling in today. We appreciate you.
Oh, thank you, Colette, for having me. I appreciate it.
You are so welcome. If you would like any additional information on today's topic, just head on over to the Hot Links page at WNEM.com.